Good morning, everybody. It's Amanda Pike from the Maternity Voice Partnership in Lincolnshire. And today we've got some fantastic guests on to talk all about what happens when your baby comes early. And today, shortly, we're going to be joined by Linda Hunn, who is the lead nurse for the East Midlands Neonatal Network. So she's bit of a big boss. So we're really fortunate to have her on today. And we'll also be joined by regular Georgina Gold, who is the inpatient matron at Boston Pilgrim Hospital. And when they finish explaining a bit about the topic that they specialise in a bit, then we will move on to the live Q&A part where you can ask anything to do with the topic we're talking about today. If you have anything that's in relation to your pregnancy in general, if you send a message in, I can pop them to one side and we can answer those next Friday on the 18th, because we'll have our usual Ask the Midwife session. But today's all about the neonatal side of things. So yeah, be brilliant. And also during the session, if you've got any questions, pop them in the chat box. And as ever, we'll get them read out and asked for you. So before I add the ladies in, I just wanted to tell you a few bits and bobs that's going on that we're really excited about. So in about 2018, the Better Birth Lincolnshire transformation team came up with the idea to start Neonatal Voices. And I'm going to mention them specifically because I think they need a little bit of celebration. But Sue Jarvis, who is the Better Births Transformation Project Manager, and Claire Gartland, who is the Better Births Transformation lead neonatal person, I probably got that all mixed up, they came up with the idea for the Neonatal Voices. And if it wasn't for them, the neonatal branch to our MVP wouldn't exist. So we're really lucky that they are such clever individuals and so passionate and came up with this idea and got us going. We were the first in the country, and now NHS England advises that every area has a neonatal voice. So we're really lucky that they're trailblazers for our county. Now, they've recently been nominated and now shortlisted for an award, which is for the National British Association of Perinatal Medicine Award. And they've been shortlisted. So we are so over the moon for them both, and we wish them all the luck in the world. It comes under making a difference to families. So what a lovely thing for them to be shortlisted for. So really good luck, ladies, and we are really hopeful that you win. You deserve it. And then the other thing we wanted to share was that the same ladies, Better Births team, they have had an article put into the National Neonatal Infant Journal, which is an amazing accomplishment. It's a journal that is for professionals and they have to subscribe to it, but it's a national item. So it was really something special that they got into that, and it's all about the neonatal voices again and how they've implemented it. So really well done to you guys again. We're really chuffed with all the hard work you help us with, and we are so proud to work with you both. And the Better Birth team in general, they're all absolutely brilliant. Right, couple of other things I just need to mention before I forget, and I add the ladies in, is on the 17th of December, we've got a listening event where we're going to have a virtual meeting online, and any service users, anybody out there that's pregnant or recently had a baby, if you want to come and join us and have a chat to us directly so we can hear your stories and your feedback and use it to learn from to help improve services, then we'd love to meet up with you. So just message the page and we can get the link sent directly to you. It's not a form of complaint. The only reason we exist is to help improve services. So anything you send us will be anonymous, but it's a great way to meet you all and hear exactly what's been going on to help and work with the NHS and see how we can improve things and suggest bits and bobs. And then the only other thing is next Friday, we have another live Q&A. So as I say, if you've got any questions in relation to your pregnancy in general, just message in and we can sort that out for next Friday. Right, I shall add the ladies in now. Good morning, ladies. Thank you for joining us this morning.
Morning.
Great to have you here. So I think Georgina is probably going to have a bit of a chat first and go through what happens within the pregnancy side of your neonatal experience and preterm birth. So I'll let Georgina carry away.
Great. Hi, everyone. So I'm going to just talk briefly about preterm birth. So preterm birth is where you deliver your baby before your 37th week of pregnancy. 37 weeks onwards, your baby is fully grown and classed as term. So we do know that babies can sometimes come earlier in pregnancy, and there are a few bits and bobs that we just like to make everyone aware of. So during your pregnancy, you will experience quite a few aches and pains and different sensations because your body is going through a massive change. You know, you're growing a little human inside of you, and especially if it's your first baby, your body's never done it before. You're going to feel things that you've never felt before. So your stomach can feel stretching as your uterus grows. You get ligaments near your pelvis which cause a lot of stretching pain. So you know, pregnancy is not always plain sailing. You can have lots of aches and pains and be uncomfortable, but there are a few times that we like you to be aware of what's going on and maybe contact a health professional. So it's quite normal throughout your pregnancy to feel irregular, painless tightenings. And that again is your body just getting used to being pregnant and kind of practicing what it needs to go through to go into labour. However, if you are before 37 weeks and you start to feel regular tightenings that are causing a lot of discomfort. I'm sorry, I'm just going to pop my mask on just because I've had a colleague walk in.
Yeah, that's fine. Yeah.
Okay, sorry about that. So if you are starting to experience regular painful tightenings and you know you're aware that they're there and they are uncomfortable, we would recommend that you contact your midwife. So you can either speak with your community team, the antenatal assessment unit or centre, both at Pilgrim and Lincoln, or your labour ward, and then you can have the conversation with your midwife to see whether okay, yes, this is normal, and you know, continue at home, or whether actually maybe we need to see you and just check out what's going on there. Paracetamol is safe to use in pregnancy, but if you are experiencing discomfort where you feel you need to use paracetamol, I would recommend that you just have that conversation with your midwife, because we don't want any ladies at home being in pain and have not sought that advice. And then obviously if the midwife feels that you need to be seen, you will be welcome to come into the hospital. When you come into the hospital, your midwife will do your antenatal check. They will make sure that your blood pressure is within normal limits, check your urine. We'll have a good feel of your tummy and see what position your baby is laying in. And dependent upon how many weeks you are, we will potentially do a monitoring of your baby's heartbeat as well on one of our CTG monitors. And that can take varying amounts of time, really. Each baby's different. It could be as little as 10 minutes and it could be, you know, as long as an hour plus. So we'll do that monitoring just to check on the well-being of your baby. And then we will also invite the medical team to come and have a conversation with you. If we feel like it potentially could be preterm labour, then we would offer an examination to have a look at your cervix to see whether there are any changes occurring. Prior to 37 weeks, we wouldn't particularly expect your cervix to be opening. So if we are seeing that, then it may be that, yes, you are going down the route of preterm birth. Now, there is a test that we can also do. It's not applicable to everybody. There are a couple of situations where we may not be able to do this, but there is a test that we can do where it's a swab inside the vagina when we're having a look with our speculum, and that will come back with either being negative or positive. Okay. If it comes back as being positive, then there is a higher chance that you may go into preterm labour and that your baby may be born before that 37th week of pregnancy. If that is the case, then again, dependent upon your situation, it may be that you might be offered some steroid injections. Now, these injections are not for you as a mum. They're actually to help your baby and help your baby's lungs mature. And that would be an injection that we give to you, 2 injections in your leg or in your bottom, and it'll pass through you into your baby to help baby's lungs. So if we do think baby is going to be delivering preterm, we're kind of giving them the best chance we can with that breathing as well. Again, there is another drug that we could potentially give to try and stop the labour. Again, it's all dependent upon individual circumstance, not applicable to everybody. But if possible, then we would pop a IV line into one of your veins and give you this drug to run through. And the aim of that is to try and slow down, if not stop, any contractions or what we call uterine activity. Okay. And there is then one more other thing that we can also offer, and that's something called magnesium sulfate. And again, that's not for you as the mum, that's for your baby. And that is to try and prevent any potential brain injury, cerebral palsy, if your baby is born early. So there are lots of things that we can do, and we can manage your pregnancy when you come in. Dependent upon how many weeks you are will depend on whether you would stay within ULHT or whether we would need to find you a cot and a bed within a tertiary centre like Nottingham or Sheffield Leicester, one of the bigger hospitals where they often see preterm babies born. I think that's a quick overview of preterm birth. Is there anything else you want me to touch upon, Amanda, or should we wait for questions?
I don't think so. I have had quite a few sent in that may be a bit different to the things you've just explained. So okay. I'll wait to those because I don't want to take away from people's questions. So that's wonderful. Yeah. Thank you. So if I had Linda over now. Hi, Linda. Thanks for joining us today.
So, thank you for having me.
Yeah. You sort of cover more of the transferring side of things, don't you? So I'll let you explain all about what you do, and yeah.
Thank you very much. So I have the responsibility for the 11 neonatal units across the whole of the East Midlands. The thing in the country really is that all neonatal units are organised into what are called networks. So you have all units are designated or called a certain type of unit depending on what care they can actually provide. So we have what are called neonatal intensive care units, and we've got 3 of those in the region. We have local neonatal units, and we have 5, I think it is, of those across the region, of which Lincoln is one. And then we have 3 special care units, of which Boston is one. The reason that care is organised in that manner is to make sure that those babies that are born earliest and smallest are cared for in an intensive care unit where they provide care for more babies. So as Georgina was just saying, they are moved, or hopefully moved there, to be able to provide that care. Because the more care you provide, the better you become at it, I suppose. So if you only have 1 or 2, then essentially you may not be so proficient at it as perhaps a neonatal intensive care would be. So ideally, if a baby is going to be born very early, i.e. less than 27 weeks if it's a singleton, or less than 28 weeks if it's a multiple birth, twins or triplets, then that mum would be moved into somewhere like Nottingham before the baby is born. Now, clearly that doesn't always happen. Sometimes mums get moved into a unit in full-blown labour. We don't have time to move them somewhere else because we need to find a bed and a cot together. If that were to happen, then absolutely there is no need to panic because all neonatal staff are in looking after very preterm babies until they can be moved. So they're trained in that initial stabilisation, ready for them to be moved. And then what we have is a neonatal intensive care transport service, a team that are very well trained to move babies in the back of an ambulance if they need to. And that's a designated service. So they are specifically there to look after the babies, and they have their own ambulances, so they can move them as and when is needed into whichever unit is needed. Once the baby is starting to get better and is getting a bit bigger and a bit stronger, then the aim is always within a network to move them back nearer to home. So as soon as we were able to move a baby out of Nottingham, we would be looking to move the baby back into Lincoln and then potentially on to Boston as that care gets stepped down. Because what you see in a special care unit like Boston is that they are the real experts in getting babies feeding and ready to go home. So they all have their own skills and attributes depending on the unit you're in, and they're specifically trained to provide just that kind of care, really. So the aim really across the whole of the network is that we have consistency and continuity. All the teams talk to one another all the time. We're unfortunately always on Teams at the moment as opposed to actually seeing face to face, but I'm sure that will improve. And we work really, really hard to make sure that the parents' experience is good wherever they are, and that we have a consistency across the region, and that all parents are involved as much as is possible in their baby's care.
Yeah, it's lovely. Yeah. Well, thank you so much for explaining all of that. I mean, you know, it's quite daunting if you were to think you're going to have a preterm baby. So I know that the information you ladies have just given will give some peace of mind for some women to some extent. I know they probably can't stop worrying because we're just mums, but, you know, at least explaining this, you know, the whole journey may help a little. So thank you. Actually, going forwards, we are going to be also having on some of the staff that actually work within the neonatal units in Lincolnshire, both Lincoln and at Boston, and we've just got to find some dates in the diary that work together, but they can then go through what actually happens within the unit. And then after that, we're going to speak to neonatal voices, so parents that have been through that journey. I'm one of them, but my baby wasn't there for that long, but there's lots that are in our group that have been, so that's brilliant. So what I'll do now is we'll move over to the Q&A part of it. Now, if anybody's got any questions that's watching, we've got quite a few viewing. Now's the time to pop them in the chat box. I have got some already sent in. I can't see any in the chat box at the minute, so I'll revert to these and then we'll go from there. So the first one is, will I be allowed to travel with my baby in the ambulance after she's born? That's probably a good one for you, Linda.
It is, yeah. And at the moment, the answer to that is no. And that's because there's a national restriction across the country because of COVID. Ordinarily, there is the potential that one parent can travel in the back of the ambulance. It does depend quite a lot on how many staff are in the back of the ambulance and how much room there is. If there is the facility for parents to move back, it would only be one. And we do ask that they don't take lots of luggage with them because of risk of anything flying about in the back of the ambulance, which we would want to reduce any risk of. So at the moment, no, unfortunately, and that's like many other restrictions across the whole of maternity and neonatal services due to COVID, we can't offer that service. Ordinarily, we would have some conversation with the parents and try to accommodate as far as is possible.
Yeah, thank you. And can I just ask from a parent point of view, so if you just had your baby and the baby needed to be transferred quite quickly, what happens with the mother? Is she transferred in an ambulance at the same time or as soon as possible? How does it usually work?
Yes, as soon as possible. Sometimes they can't if they've had a cesarean, for example, and then they need a bit more medical care themselves. If that were the case, then we would endeavour to make sure we use FaceTime or something from the neonatal unit so that mum can see the baby. And what the transport service tend to do is move the baby in the incubator to see the mum before they move. So once they've stabilised the baby, they will then just move round to wherever mum is so that mum can have a quick peek and see a baby and maybe touch a baby before they move.
That's lovely.
really hard to facilitate FaceTime. They've got various other media outlets that they use as well to make contact with parents when they're at home.
The marvels of modern technology, eh? That's brilliant. Okay, next one from Vicky. She writes, can smoking make my baby come early? This is probably a good one for Georgina. Hello.
Yeah, hi. Yes, it can actually. So smoking, unfortunately, has got multiple risks associated with it. And one of those is the potential for preterm birth. As midwives and health professionals, when you book with your pregnancy, we do have these conversations about smoking. I think it's really important that women are fully aware of the implications and the risks of smoking during pregnancy. And it's not always first-hand smoke. It can be passive smoking as well. So if you've got people within the family that are around you, because you're still going to be breathing in that second-hand smoke. So preterm birth is most definitely a risk of smoking, as are lots of other things. So having a very small baby, because the smoke can actually reduce the amount of oxygen going through your placenta and to your baby. So your baby is not growing potentially to the level that they should be. Lots of other things like miscarriage early on in pregnancy. Unfortunately, stillbirth, it's a risk factor for that. So, later on in pregnancy, 38, 39 weeks, when I guess you automatically as a mum having a baby think that you've got to a safe point at that stage, but smoking can cause really awful things to happen in pregnancy, and stillbirth is one of those. So there are multiple risks of smoking. And not only that, once your baby is born, it can affect the baby's ongoing health. So we know that babies that have been born to mums that smoke are higher chance of having things like asthma or infections. So we don't advocate it, but we like to talk about the risks so that we can provide that informed information to the mum and the family. And there are lots of things that we do within our services to help with ladies that do smoke. So we've got One You Lincolnshire, which are really good, and we work in association with them. And also we offer things like nicotine replacement therapy. So that is available within both of our units for any mums that might be wishing to take that up. But these conversations we like to have on a very regular basis, just, to optimise really the health and well-being of both mum and baby and the whole family.
Yeah. Brilliant. And also, I learned last week that the One You Lincolnshire group also, am I right in thinking your partner or your their grandparents can also be seen by them? Is that right? I think so.
I believe that's my understanding as well. Yes. If that's not the case, then I'll let you know and we can inform everyone. But I think
it is. Yeah. So that's great. So if you really needed some support and they wanted to go with you, that would be brilliant.
Yes. Yeah.
Okay. So nothing in the chat box at the minute. Right. I've heard that you can have medications to stop delivering your baby early. Is this true? You've just spoken about that actually, haven't you? So
I guess that's probably what I've just touched upon. So we use something called a Tosiban, but it's another word for it is a tocolytic. So it tries to reduce your uterus from having those contractions. Now, if we've got a lady that we think is going into preterm labour and she is having uterine activity, contractions, then we will give that drug. And as I say, it's through a vein into mum. And we do continuous monitoring of both mum and the baby to check the well-being throughout. It can't necessarily stop labour altogether, but the aim of it really is to try and delay everything so we can get those injections of steroids in, and we can make as many plans as possible to provide the best care, whether that is transferring to another unit or whether it's just getting the steroids on to deliver within ULHT.
Great, thank you. Okay, so the next one, I think this is going to be one for Linda. I had a friend whose baby had to be moved to Nottingham. I live near Boston, so this would be very far for me to travel. Can I have my baby at Boston Pilgrim Hospital if she comes early, as I've been told may happen? And if so, where can I stay?
Okay, so the answer to that is that totally depends on how early the baby is, and whether that meets the requirements of the special care unit at Boston. So if it's from 32 weeks onwards, then that baby would be born in Boston, yes. But if it was earlier than 32 weeks, then we would have to either be in Lincoln or Nottingham, depending on how early the baby was going to be. If you needed to go somewhere else because the baby was too early to be born in Boston, then we would endeavour to make sure that you've got some accommodation to stay in. So all neonatal units have to have some parent accommodation. Generally, that's quite nice. It includes a kitchen, so you can do some food, shower facilities, bedroom. And we try to aim, especially for parents that come from longer distances away, to make sure that they have accommodation available to them. We can't always promise it, and it has to be allocated depending on how poorly the baby is and how far away you come from. So we have to sort of very carefully look at what babies we've got on the neonatal unit and what parents actually need accommodation. But generally speaking, the further away you come from, the more likely you are to get some accommodation. So we do try our very, very best. Unfortunately, in neonatal services, like other NHS services, it's not perfect, but we really do try as much as we possibly can. And if you have to go home and come backwards and forwards, then we use social media as much as possible to try and help you to be involved in ward rounds if perhaps you can't get there early enough in the morning, or late at night and you want to say goodnight to your baby or see your baby before you go to bed, that kind of thing. So nurses really do try as much as possible to accommodate that.
Thank you. Okay, there's another one here that may be good for you, Linda. So I'm 28 weeks pregnant and worrying about my baby. If she does come early, will she be okay?
We can never say yes, absolutely, they will be okay. But it has to be said that the survival rates for babies are much, much better than they used to be. Medical technology has moved on in great strides. And generally 28-week babies do very, very well. You'll always get the odd one that perhaps won't. So I can't lie and say that they absolutely would be okay. But on the whole, yes, I would say they would be. We've got really good medical teams in each of the units who work really hard, and the medical advances and the treatment that they are able to offer is second to none, really. So the chances are very good.
Thank you. Right, one for Georgie next. So it says, what sort of signs would tell me that I may be going into early labour, and when should I phone for advice?
Okay, so if your waters break at any point, whether you've got any pain or contractions at all, you should always contact the unit that you're booked at for advice to come in. But if it's about contractions, so as I say, throughout your pregnancy, it's quite normal to get painless, irregular tightenings. That's just your body getting used to being pregnant. But if they're painful and you're very aware of them, and they might potentially start off quite far apart, but then throughout the day or the evening, they're gradually getting closer together, potentially more of a pattern, more regular, then, this is really the point that you need to be getting some advice from your local maternity unit. Don't leave it too late. It's better to get advice sooner rather than later. It might not be anything, it might be normal for you and for your body, but there's no way of knowing that really unless you have that conversation. The midwife can have a very in-depth conversation with you and about what's going on with your pregnancy, because every pregnancy is different. And then if you need to come in, you'll be offered to come in for that well-being check of both you and baby.
Great, thank you. We've got just about a minute left. So if anybody's got any questions related to this topic, now's your time to pop them in. I see, Chantel, you've asked a question about inductions. As I said earlier, I'll just pop that to one side and we can get that answered for you on Friday. So that'd be great, because today we're just focusing on preterm babies and what happens when they're transferred, if they need to be, because not all babies need to be. Okay, right, another one for you, Georgina. So I've heard of premature rupture of membranes. What is that exactly?
Okay, so that is where your waters break before you become terminal pregnancy, so before you get to the 37-week mark. And we know that it does happen. Sometimes there might be a reason or a cause. It could be that there's an infection going on, or sometimes we can't put it down to anything, but it's happened. When your waters do break, they can be different colours. So if it's a clear or a straw colour, then that's kind of the best scenario if we had to choose a best one. If you might get it where it's pink, which has got the blood which has stained through your water, or it could be a greeny or a browny colour, and that can be where your baby's actually had a poo inside of you and it's mixing in with the water that's coming away.
Okay.
So if you are preterm, then you should always contact your maternity unit for advice anyway if your waters are breaking. If they have broken, it may be that you continue to leak throughout the rest of your pregnancy, whenever that may end, dependent upon those conversations with you and your obstetric team. Or it might be that you have a one-off leak and then you don't really notice anything else. But make sure you still pay attention to that one-off leak and you get checked out, because we do know that sometimes the waters can break quite high up inside the uterus, and therefore it's very difficult for more water to come out. Sometimes people call it a hindwater leak. So if you think that you've had any water leakage at all, then get yourself checked out, because it's always better to be safe, really, so that we can make sure that we've made that correct plan of care for you.
Brilliant, thank you. And Georgie, I always get all you midwives to repeat this because I hear it so often, but it doesn't matter how many times a lady contacts you, does it? You know, as long as she gets checked out, you don't mind how many times it is, do you?
No, not at all. And as you all know, as midwives, we're chatters. We like to talk to everyone. We like to get to know our ladies, and we really don't mind. We would rather you phone us 10 times and then feel reassured than sit at home and worry. Not at all. It's what we're here for. So whether that's your community team, the antenatal assessment clinic, labour ward, maternity, you know, whoever it is, please call us and have those conversations.
Great. Okay, I'll do one last question for Linda and then we'll finish. So it is, I'm told we may end up in Nottingham to have our son. When will we be able to come back to a hospital nearer to home?
Okay, so as soon as your baby meets the criteria for a neonatal unit that is closer to home, so Lincoln or Boston, then the team in Nottingham will endeavour to get your baby moved back, and that will be through the same process, using the transport service again, so that they can look after your baby in an incubator in the back of the ambulance and transport the baby back home. What we do have on our network website is some virtual tours of the neonatal units. So if people are moving from one unit to another, they can actually see where they're going before they go. And sometimes they find that quite reassuring. I think sometimes parents worry when they've been in Nottingham with all the high-tech equipment, etc., because it's a neonatal intensive care unit, when they're told that they're going to move somewhere that isn't a neonatal intensive care unit, because they feel that perhaps they won't be looked after so well, which is absolutely not the case. Yeah. So each unit is the staff within that unit are specifically trained to look after a baby at that particular gestation that they're able to look after. So please don't worry about that. If your baby is being moved back, see that as a really positive sign that your baby's getting better and is able to move back closer to home.
Yeah, thank you, Linda. And I know from feedback that we get and the experience that I've had myself, you know, once you are in a new unit, the ones in Lincolnshire are so friendly, so welcoming. They really go out of their way to help the families that are on the unit. So although it may be daunting, you'll be fine as soon as you get there. So right, that's everything for today then. Thanks so much. Coming up, as I said before, we're hopefully going to have the neonatal staff have a chat to you all at some point, and the neonatal voices. And on the 17th, just as a little reminder, we have got a listening clinic that we'd love for some of you to attend. So just send us a message and we'll send you the link so that you can join in on the virtual meeting. And also on our new Mum and Baby app that we've got in Lincolnshire now, it's absolutely brilliant, and I've put a link to it in the description of this video. You can find on there loads of information about your neonatal journey, and also in the Better Birth section it takes you to Facebook, and on there you can have a tour of the units for the videos. So definitely check that out. I'd just like to thank Better Births in the chat box as ever for beavering away and adding all those links. That's such a help. And finally, a massive thank you to both of you ladies for joining today. I know Linda must be really busy, as is Georgina, so the fact that you're able to, you know, take the time to help and explain these bits and bobs to families, we couldn't be more thankful for. So thanks for joining us, everybody, and we will see you next week on the 18th for our usual Ask the Midwife section. Okay, thanks everybody. Bye.
Bye.
Bye.